Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here are the top highlights from the ESC. Does continuing beta blockers after a heart attack make a difference? New study sheds light. New research presented at ESC Congress 2024 found that stopping beta blocker treatment after a heart attack doesn't improve patient outcomes or quality of life compared to continuing the medication. The open-label non-inferiority randomized ABIS trial conducted by the Action Group included patients with prior myocardial infarction taking long-term beta blockers with a left ventricular ejection fraction of at least 40% and no cardiovascular events in the previous 6 months. Participants were randomized to interrupting or continuing their beta blocker medication. No benefit to fasting before catheterization procedures. SCOFF trial. New research presented at ESC Congress 2024 shows that fasting or non-fasting before cardiac catheterization procedure with conscious sedation does not affect the rate of complications. The SCOFF trial, a randomized study with an open-label design and blinded endpoints, evaluated whether not fasting before cardiac catheterization procedure require conscious sedation was as effective as fasting. Patients scheduled for coronary angiography, coronary interventions or procedures involving cardiac implantable electronic devices were included. They were randomly assigned to either fast before the procedure or to eat normally with no strict fasting requirements. Finerenone reduces heart failure events and cardiovascular deaths. FINEARTS-HF trial. Recent research presented at ESC Congress 2024 revealed that Finerenone decreased the incidence of heart failure events and cardiovascular deaths in patients with heart failure and either mildly reduced ejection fraction or preserved ejection fraction. The FINEARTS-HF trial was a double-blind randomized study involved patients with heart failure and a left ventricular ejection fraction of 40% or higher. Participants were also required to be 40 years of age or older, have elevated natriuretic peptide levels, and shows signs of structural heart disease. Eligible patients were randomly assigned to receive either Finerenone based on their initial estimated glomerular filtration rate or a placebo. The main goal of the study was to assess a combination of worsening heart failure events and cardiovascular death. Study shows no advantage of nighttime blood pressure medication over morning dosing. In 2 trials involving frail elderly patients, taking blood pressure lowering medications in the evening didn't offer any clinical benefits compared to taking them in the morning, according to new research presented at ESC Congress 2024. In the BEDMED trial, Canadian patients without glaucoma who were taking at least 1 daily blood pressure medication were randomly assigned to take their medication either in the morning or at bedtime. The main goal was to see if the timing affected major health problems like death, stroke, heart attack, or heart failure. Secondary goals include checking for unexpected hospital visits and issues related to vision, cognitive function, or fractures. Single pill combination of 4 blood pressure medications outperforms 3 medication pill. QUADRO trial reveals. New research presented at ESC Congress 2024 revealed that a single pill combination 4 blood pressure lowering medication is significantly more effective than a pill with just 3 medications. In the QUADRO trial, patients with resistant high blood pressure first went through a 8-week period where they took a combination of 3 medications, perindopril, indapamide and amlodipine at the highest doses they could tolerate. If their blood pressure remained high after this period and they were following the treatment, they were then randomly assigned to either keep taking the 3 medications or switch to a single pill that combined perindopril, indapamide, amlodipine and bisoprolol. Both groups took the same number of pills daily to keep the study blind. The main measure of success was the change in blood pressure at the doctor's office, while secondary measure included monitoring blood pressure over 24 hours at home and in the office. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.